I think one of the important aspects of being in rare disease is being able to find patients, um, to find them for the right solution at the right time. So one of the ways that we're able to do that is through data and analytics. We can actually create our own Phish finders where you look for different types of patients and you can geolocate them. And that geolocation can help us work with physicians in the community to identify these patients with the right signal. Of course, making sure that we're doing that compliantly and we're protecting them from a HIPAA perspective. But it's allowing patients that maybe have languished in the healthcare system to come to the right doctor at the right time. So having that as a backbone so that we can apply the right finding techniques. And then once we identify the right patients and they're on our solutions, having the right services that meet those patients at each step of their journey so that they can communicate well with their physicians, they can voice their concerns, but we can also help them with the administration of their medicines, and also use data and devices to help predict when they may have a symptom exacerbation in the case of myasthenia gravis. Let me transport you to Amazon when you're searching for your green sweater, okay? Typed in green sweater. Then you see at the bottom of the page, other customers who wanted to buy a green sweater, these are the other green sweaters that they bought. So it's called a lookalike algorithm. So what we end up doing is we find patients based on diagnoses codes. Then we also have other codes anytime they hit the healthcare system. So we create a template, basically a template that says, this is a cohort of patients. Prior to diagnosis, 1 year, they had symptoms of eyelid drooping and muscle weakness. 2 years before, they had some other interaction. So we take this template, then put it on a cohort of data and start to basically identify the other green sweaters. So other patients that look like this MG patient. We can take that information, then put it into our CRM for our sales representatives that say, you have a high likelihood of a patient needing a new targeted therapy. Please call on the following 4 offices as they are in the catch net of a patient that lives nearby. So the other thing we can do is look at HCPs, their patient catch net. So who is their patient load and how are they being treated and compared to treatment guidelines? Let's say they're using a ton of corticosteroids and not moving up fast enough to targeted therapies. That would be a great physician to educate and say, here's the new round of 3 therapies who've come out in the last 3 years. Doesn't have to be promotional in nature, but educational. You need to be aware of these treatments. And they may be absolutely right for some of your patients. And by having them sit on steroids too long, you're actually having poorer outcomes compared to your peers down the street.